pyelonephritis interventions focus on kidney protection. So we should start by preventing dehydration and encouraging fluid, at least 2 liters of fluid a day, because hydration keeps the kidneys flushed and reduces the risk of acute kidney injury. And nausea and vomiting can be severe with pyelonephritis, so anticipate antiemetics such as ondansetron for relief. And if the client is too nauseated to drink, anticipate IV fluids. And closely monitor kidney function. Watch urine output as well as BUN and creatinine levels. So for NCLEX, remember to prevent dehydration with pyelonephritis because it is the quickest way to acute kidney injury. With pyelonephritis, we must stop the client from turning septic. So how do we do this? Well, first, we should collect blood cultures before antibiotics. Remember, the NCLEX loves to test on this sequence. Cultures first, antibiotics second. So once our blood cultures are collected, it is go time. We should administer antibiotics, and typically IV antibiotics are needed. And finally, always monitor vital signs closely because a drop in blood pressure and an increase in heart rate indicate possible sepsis and require immediate intervention. Finally, when talking about pyelonephritis treatment, remember it isn't just dangerous, it's uncomfortable. So what can we do to help clients feel better? Well, for fever and pain, we should administer NSAIDs and acetaminophen. And for that deep aching flank pain, a heating pad or warm compress can decrease this discomfort. Now it's time for our last NCLEX quick check. Let's pause and see if you can answer these questions. Which findings in a client with UTI suggest progression to pyelonephritis? Well, we will see systemic findings like fever and vomiting, and those classic signs like flank pain and CVA tenderness. Which 2 complications should you monitor a client with pyelonephritis for? Acute kidney injury and sepsis. And finally, what is the priority intervention for clients with pyelonephritis? We should encourage fluid intake or IV fluids to prevent an acute kidney injury.